Psychotherapy, the talking cure, have existed since the 18th century. In seeking the answers to how the mind works, humans have been down many different roads. Thousands of years before, where in language people told stories, and some of those stories would have acted as a kind of therapy. The right story at the right time can heal as well as paths of wisdom as to how to deal with the pattern we encounter in life. In the late 1080s, Sigmund Freud was working with his mentor, neurologist Joseph Breuer, on patients who were considered hysterical, which meant they had physical symptoms for which doctors couldn't find a physical cause. And it appeared that some kind of psychological factors were causing these physical symptoms. Breuer and Freud then began to develop what he called a talking cure, whereby his patients would talk about things and find relief from these symptoms, which could range from paralysis to blindness by talking. Freud became real interested in this matter. He started practicing it and realized he could learn things about people from having them free associated. After that, he started by doing hypnosis, but he later turned such as free association, dream interpretation, transference, and analysis of the ID, ego, and superego. During 1920s, behaviorism was also developed, and behavior modification in the 1950s and 1960s became popular as a therapy. These techniques based on theories on operant conditioning, classical conditioning, and social learning theory. This period represents a general decrease of advancement in the field of psychotherapy because behaviorism denied or ignored internal mental activity. Then, in 1950s, Carl Rogers benefited from the work of Freud's successors by establishing the person-centered therapy approach. Later, Albert Ellis developed the first form of cognitive behavioral therapy, and Aaron T. Beck developed cognitive therapy a few years later. In contrast towards the insight-based approach of psychodynamic therapies, or the newer relational approach of humanistic therapies, both of these included therapy aimed at changing.
The underlying premises of a theory are referred to as theoretical assumptions. Every theory, initiative, belief, and activity is predicated on some sort of premise because they are a part of their cultural or professional history. However, these are frequently overlooked by individuals concerned. Both the client and the counselor should be theoretically oriented. Every mind is unique, and every person reacts to treatment in a unique way. A therapist could excel at one type of psychotherapy but struggle with another. A client could not enjoy one therapy yet respond well to another, on the other hand. First, it's applicable to any circumstance where a reasonable expectation of liberty exists and freedom is threatened. Second, it offers advice on how to make behavior change programs less reactive. First, it assumes that everyone has the right to freedom. Second, it may be challenging to gauge reactance and freedom.
My name is Jaishan Bapujairaj. Today I'm going to talk about the techniques and skills that used in this theory. First of all, we start with the behavioral therapy. Behavioral therapy conditioning techniques begin to play an important role in psychotherapy. And the second one is cognitive behavioral, which is psychotherapeutic treatment that helps patient to understand and helps the patient understand the thoughts and feelings that influence their behavior. And the third one is humanistic therapy, which is psychotherapy which focuses on helping people maximize their potential and stress the stresses and the importance of exploration. Okay, the fourth is psychoanalytic therapy, which is these psychoanalytic approaches involve delving into a person's thought and past experience to seek out unconscious thoughts, feelings, memories that may influence behavior. That's all from me. Thank you.
For application of theory to resolve client problem, is a psychotherapy theory provide a framework for therapists and counselors to interpret a client behavior through and feeling and help them navigate a client journey from diagnosis to post-treatment. There are three examples of theory. Number one is behavioral theory. Behavior theory is based on the belief that behavior is learned. Classic conditioning is one type of behavior therapy that stems from early theorists, even Pavlov research. Pavlov executed a famous study using dogs, which focused on the effect of a learned response. For example, a dog salivating when hearing a bell through a stimulus that can be paired when hearing the sound of bell with food.
Cognitive theory. This counseling theory focuses on how people thinking can change feelings and behaviors. Unlike psychodynamic theory, therapy based on cognitive theory is brief in nature and oriented toward problem solving. Cognitive therapists focus more on their client's present situation and distort thinking than on their past. Cognitive and behavioral therapy are often combined as one form of theory practiced by counselors and therapists.
Now, there are some problems in psychotherapy. As therapists are human too, they're prone to error. Sometimes they might get the wrong diagnosis, or the patient might not be cooperative. And even if everything goes smoothly, the patient may start to get dependent on therapy. Some people may end up thinking that the only time they can express how they truly feel is during therapy. And while this isn't bad, it isn't good either, and they might end up at an impasse. More importantly, that dependency might cause some side effects to occur, and those side effects can concern not only symptoms like an increase in anxiety or cause of illness like enduring false memories, but also negative changes in family, occupation, or general adjustment in life.
In conclusion, psychotherapy helps people with depression understand the behaviors, emotions, and ideas that contribute to depression, regain a sense of control and pleasure in life, and learn coping skills. Psychodynamic therapy is based on the assumption that a person is depressed because of unresolved, generally unconscious conflicts, often stemming from childhood. Interpersonal therapy focuses on the behaviors and interactions with family and friends. The primary goal of this therapy is to improve communication skills and increase self-esteem during a short period of time. Psychotherapy has been shown to be as effective as medications for depression, and some people, especially with early life stress issues, may not respond to medication without psychotherapy. Psychotherapy plays an essential role in the treatment of mental disorders. The use and research of psychological treatment strategies increased drastically over the past decade. The general efficacy of psychotherapy for the treatment of psychiatric diseases is proved and documented in several meta-analyses. Psychotherapy researchers have found solutions for acceptable study designs which account for the special character of these interventions and studied the efficacy of psychotherapeutic treatment in more than 1,000 intervention trials. Meanwhile, evidence-based psychotherapy approaches tailored to a specific diagnosis are dominating the field and question the basis of psychotherapy schools. A new field of research in psychotherapy is the neurobiological basis of the mental disorders and the demonstration of neurobiological changes with psychotherapeutic treatment.